Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Overactive Bladder Syndrome, OBS. Introduction. Overactive bladder syndrome, or OBS, is a condition that causes a sudden urge to urinate or pee. OBS may be hard to control. It can lead to the accidental leakage of urine or incontinence. This program explains overactive bladder syndrome, or OBS. It talks about the symptoms and causes of the disorder. It also covers how OBS is diagnosed and treated. Anatomy. Your bladder is a hollow organ in the lower abdomen. The bladder stores urine until it passes out of the body. When your bladder is full, the nerves around your bladder tell your brain that you need to urinate. The wall of the bladder has layers of tissue. The middle layer is muscle tissue. When you empty your bladder, the muscle layer in the bladder wall squeezes the urine out of your body. Symptoms. The most common symptom of OBS is the sudden and strong urge to urinate. This urge may be hard to control. Your bladder is considered overactive if you have to urinate over 8 times per day. OBS may cause you to wake up 2 or more times per night to urinate. OBS may cause urge incontinence. This means that you may accidentally leak urine after feeling the sudden urge to urinate. Some people find OBS embarrassing. If you have OBS, you may avoid certain social or work situations. It may disrupt your sleep. OBS may cause feelings of depression. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. Overactive bladder syndrome happens when the nerves around your bladder tell your brain to urinate even when your bladder is not full. It may also happen if the muscles in the walls of your bladder contract too quickly or too often. The cause of OBS is not always known. Some neurological disorders, such as Parkinson's disease, can cause OBS. Diseases that affect the kidneys, such as diabetes, can also cause the disorder. Other causes of OBS include medications, drinking too much liquid, urinary tract infections or problems, too much caffeine or alcohol. Anyone can have OBS, but it is more common in women. Your risk for OBS increases as you age. Diagnosis. Your healthcare provider will ask about your medical history. They will perform a physical exam. Your healthcare provider may ask you which liquids you drank during a normal day and how much you drank. Your healthcare provider may take a urine sample. He or she will test the sample for blood or signs of other problems that may cause OBS. You may be asked to keep a diary of how often you urinate during the day and night. Your healthcare provider may recommend tests that check the pressure of your urine and the inside of your bladder. They may also order an ultrasound of your bladder. Treatment. Overactive bladder syndrome can be treated a variety of ways. Treatment depends on each person's specific case. Your healthcare provider will work with you to work out a treatment plan that works best for you. Usually, a combination of exercise, medications, and bladder training are recommended. Your healthcare provider may recommend exercises to help strengthen the pelvic floor. These are known as Kegel exercises. Talk to your healthcare provider about proper Kegel exercise techniques. Medications that help relax bladder muscles may be prescribed. You may be able to train your bladder to empty at the right time by taking scheduled trips to the bathroom or planning delays in when you urinate. You may need to change how much liquid you drink. Drinking less caffeine and alcohol can also be helpful for some people. If you are overweight, losing weight can help. Rarely, your healthcare provider may use Botox injections to treat OBS. Botox can partially paralyze the bladder. This can help with muscle contractions that cause OBS. When other treatments do not work, your healthcare provider may recommend surgery. There are several types of surgery. Talk with your healthcare provider about your options. Your healthcare provider may recommend a nerve stimulation implant. Nerve stimulation sends electrical impulses from a small device under your skin to the nerves around your bladder. These impulses can change how the nerves work. This can stop the nerves from telling your brain to use the bathroom when you don't have to. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Your bladder is a hollow organ in the lower abdomen. The bladder stores urine until it passes out of the body. When your bladder is full, the nerves around your bladder tell your brain that you need to urinate. Overactive Bladder Syndrome, or OBS, is a condition that causes a sudden urge to urinate or pee. OBS may be hard to control. It can lead to the accidental loss of urine or incontinence. Overactive bladder syndrome happens when the nerves around your bladder tell your brain to urinate even when your bladder is not full. It may also happen if the muscles in the walls of your bladder contract too quickly or too often. Certain exercises and behavioral techniques can help treat overactive bladder syndrome. If you are overweight, losing weight can help. It may lessen pressure on the bladder and help prevent incontinence. Your healthcare provider may prescribe medication along with behavioral techniques to treat OBS. Talk with your healthcare provider about which treatment options are best for you. Thank you for using Explain.